always related to the shift in our universal healthcare law, that we should also be on the lookout for the cost, kasi eventually nga when the payment becomes capitated, mahirap if your armamentarium is laging high-end, mga matatapang na antibiotics. And then technology is also catching up and also evolving. So remember the lecture of Lenny before, na dami na pala mga bago ngayon to detect early, not waiting for the culture to come out. But again, that is double-edged in terms of the cost. So not linger any long, but I'm looking forward, Nina, to your lecture. Thank you very much.
Thank you, Dr. Edwin. So for today, we are truly honored to have with us one of the country's esteemed infectious diseases specialists, just like what Dr. Edwin mentioned. So she's an associate professor at the University of the Philippines, Philippine General Hospital, and the section head of the infectious diseases section of the Medical City. She's also the country lead investigator of Favipiravir clinical trial for COVID-19 treatment and the chair of the steering committee of the National Antimicrobial Stewardship Program of the Department of Health. So together, let us all welcome Dr. Regina Berba. Good morning, Dr. Anina.
Hello, good morning, everybody. Thank you, Edwin. Thank you, Monica. Wait lang. So I'm waiting for my slides. But I can put up my slides. Sandali lang po. Okay. So today, binigyan ako ng assignment ni Gina. Antimicrobial stewardship during COVID-19, changing the way we think of antibiotics. So these are my disclosures. So nakasulat dyan sa red, classmate ako talaga ni Dr. Edwin Mercado. We're brothers and we're classmates, and we've known each other. Pumupunta pa, panay niya kami iniimbita sa bahay nila nung estudyante kami.
Nag-free clinic yan dyan sa Tanawan, sa DMMC.
So, yan. But I think wala naman siyang effect sa aking lecture today. So, no conflict of interest. So, I'll start my talk with just a brief overview of what AMR is. So, ito na nga yung when microorganisms which cause infections, they could be bacteria, virus, fungi, or parasites, survive the exposure despite the medicine. So parang sa Tagalog yan, immune na sa mga antibiotics, diba? So when drugs don't work. And over the years, we've seen and we've heard and maybe we've experienced the threats of AMR to human health. So over and over again, ayan yung mga lumalabas sa mga magazines, sa Facebook, sa tweets, no? When antibiotics seem to be losing their power, and parang may recurrent question, are we losing the war against this ID bugs? They've been called super bugs recently. So, but our fight against AMR has also started many years ago. So, merong parang apocalyptic fantasy, no? Parang sa sa kwento-kwento lang na dadating yung panahon na there will be no more antibiotics that could treat minor infections. But really, this might not be just a fantasy, but a true possibility. And this was reported by the WHO as early as 2014. So, more and more, we've been realizing that baka talaga dumating yung panahon na all of the drugs we have right now would be ineffective. And in fact, the deaths we experience now are really much higher. So, ito yung WHO data on risk of death. So, when the organisms are not resistant, they have parang a baseline rate of something like this. Mga 12% for mga E. coli, for Klebsiella, mga 10 to 13%, and for Staph aureus, mga 17%. But you would see that when they're resistant, yung mga bugs have become resistant, then the death rates at least double up. Okay. So in 2016, there was this UK report by Jim O'Neill. He's not a doctor, he's not a biologist, he's actually an economist. Pero nung inaral niya lahat ng mga data, parang by himself natakot siya. So this was a commissioned work. And I think this is one of those extraordinary books, which whenever you get a chance to read it, you should read it. Okay, so it's about tackling drug-resistant infections globally. And here, as an economist, he was able to say and conclude and forecast na kung ngayon, when he wrote it 2016, the world was already showing a data of as much as 700,000 deaths directly or indirectly related to antimicrobial resistance. So ito yung mga namamatay natin mga pasyente dahil wala na tayong mabigay na gamot. So globally, that's around 700,000. But look at his estimate pagdating ng 2050. No? So it could be as much as 10 million deaths. And that's very, very, very high. And 2050 is not very far away. So we need to act now. And this is really estimates pre-COVID. So hindi pa na lagay dito, hindi niya na forecast na magkaka-COVID along the way. And sometime last year in 2019, there was actually again this reverberating warning from now, not only the WHO, but the United Nations also, that there's no more time to wait. We really need to secure our future by fighting the occurrence of drug-resistant organisms. So dun sa messages of this 2019 report, sinasabi na this is a global crisis, very alarming ang rates natin, and there's no time to wait. And we need to act urgently. So parang ganito yung 2050. Pagka totoo na yung 10 million deaths for that particular year, the death toll would be something like 1 person every 3 seconds. Parang may mamamatay from AMR. So 2050 is only 30 years away. So kung ako ko-compute ko, sana buhay pa ako by then. So when they looked at factors contributing to AMR, you would see here that the biggest circle is because of misuse or overuse of antimicrobials in humans. Okay? So knowing that, we seem to think na kung maturuan natin lahat ng mga prescribers paano gumamit at mag-prescribe correctly, maybe that's one of the solution to AMR. So antimicrobial stewardship may be one of the solutions to fighting off this looming threat of AMR. So technically, AMS or antimicrobial stewardship is a commitment. Okay? So dapat kung sa lahat ng slides ko, ito sana yung maalala nyo. It's a commitment to always use antibiotics appropriately and safely so that we use them only when we need them and we choose the right antibiotics. So parang panay tayo may checklist pag nagpre-prescribe tayo. Is this the right antibiotic? Is this the right dose? Is this the right route? And is this the right duration? And sana dadating yung panahon na bilang prescriber, tayo lahat, ang sagot dito panay ay yes, 100%. We're committing that we will be using every antibiotic correctly. And that in time, we individually and collectively will have no more wrong answer. So, parang ganito yan.
May lecture lang kami.
We'd like to see that outcomes improve, patient outcomes, and we slow down emergence of AMR, we reduce costs and reduce harm to patients. It's a systematic, multidisciplinary, multi-pronged intervention. So for example, kayo sa QualiMed, pwede magkaroon ng AMS program. Or siguro may AMS program na kayo, papalakasin pa. Okay, so when you're in front of a patient, the fundamental challenge is always to make the best decision for the patient and also for the One Health approach. No? So panay natin iisipin, tama ba? Kailangan ba ito bigyan ng antibiotic at saka anong dapat ibigay? So providing timely and appropriate empirical therapy is something we need to balance between reducing unnecessary use. Eh ano ba naman kung bigyan natin ng pinakamalakas na antibiotic bawat pasyente? Pero we know that that's not safe and that's not always the best choice for our patients. So always, parang bilang doktor at bilang prescriber, this is a basic and a recurring challenge to all of us. But we need to keep on like working on it so that we meet the objectives of AMS. Yun nga, yung kanina sinabi natin, improve patient outcomes, reduce the likelihood of occurrence of AMR. Tapos dumating si COVID, ano nangyari? So kanina nakita ko yung marami yung mga videos. Surely you experienced that during the lockdown, parang nag-decrease yung workforce, the staff was always fearful, anxious. We're trying to take care of our COVID patients, but at the same time, we try not to get ourselves infected as well. So we limit our exposures inside the COVID areas. And the work staff have been really very, very busy. Medyo intense yung life natin in the last several months, diba? And patients were very ill. Doctors and nurses want to save them, want to give our all to them, and families are pleading, oh, nako, please give everything you have to our family members. So this is a situation that's present in many hospitals in the Philippines and also around the world. So ang nangyari, to cope, many of our usual AMS restriction and surveillance activities were deferred. Guilty ako dyan kasi sa PGH, at some point, bandang mga March, I said, sige, stop muna yung mga approval natin kasi parang dagdag trabaho and we're already overwhelmed. So very unknowingly, we actually made room for more resistance to occur. So yan ang totoong nangyari. And if you see mga entries into Twitter accounts and Facebook, at saka yung mga published narratives of various doctors, talagang parang hindi mo sila masisisi na nag-overdiagnose or overprescribe, diba? Kasi gusto mo talaga ma-save yung mga patients. So how did COVID-19 accelerate the threat of antimicrobial resistance? So more recently, ito na yung mga pinag-uusapan ng mga tao na totoo naman na COVID-19 did seem to increase AMR. Lalo. Okay. So different observations, for example, by the CDC as reported sa BMJ said na parang dumami talaga yung antibiotic usage. Siguro, QualiMed can look into that kung kayo rin, despite the reduction in the number of patients, dumami nga ba yung prescriptions. Tapos, parang since we were also trying, yung mga really sick COVID patients ended up having a lot of invasive procedures. There was room for more and more of the healthcare-associated infections. In the CID report, talagang parang nag-zoom into Asia daw. Mas sobrang dami nating prescriptions considering na konti lang pala yung mga isolates na nakuha. 70% were receiving antimicrobial agents versus only a 10% presence of bacterial infections. So sa PGH, ito yung parang na-experience namin. Parang you would see dun sa orange column, which represents the first 6 months of 2020, which were the peak of our COVID response. Tumaas talaga yung Klebsiella, ESBLs, yung MRSA, yung mga carbapenem-resistant Klebsiella, Pseudomonas E. coli, and Acinetobacter baumannii. So there's been an increase talaga. So, and when you listen to WHO reports, this is parang a list of the drivers of AMR during COVID-19. Again, topmost would be misuse and overuse of antimicrobials, exposure to the healthcare system, nagsa-self-medicate or low public awareness. And then again, yung parang hindi na tayo masyado nag-AMS because resources were redirected elsewhere. Okay. There's also some concern about the overuse of biocides. Yung sobra daw nating paggamit ng mga disinfectants also seem to add to the problem about AMR. It seems to choose certain gram-negative, selects certain gram-negative bacteria. So these are the WHO recommendations to recommit, no? To go back to AMS. And the first one is to increase clinical competence of our healthcare workers through targeted training. So itong mga ginagawa nyo na training, workshops, webinars, Zoom meetings, to increase competencies of physicians and prescribers. So kailangan, one, makita natin kung sino ba yung severe COVID and who would require antibiotics. And maybe who doesn't require antibiotics, yung mga mild or moderate. To be better able to diagnose who has or who doesn't have bacterial or fungal disease. Also, to eliminate unnecessary antibiotic use. Okay. The other WHO recommendations are letter B, to ensure that there's continuation of certain services. So kung may TB dots clinics kayo, I hope hindi siya nag-stop. Kung meron kayong HIV hub, yung treatment hub, sana hindi rin siya nag-stop. And hopefully you continue to have vaccine clinics. Okay. Letter C is reduce the turnaround time of COVID-19 testing. So the faster you're able to release the results after the testing, mas okay yan. At saka yun nga, exercise maximum caution in the use of all the biocides or disinfectants for environmental and personal disinfection. So, yung National Antimicrobial Stewardship Program, ito yung nangyari sa kanya, no? So, actually, in 2018, it was pronounced as one of the key achievements of the first National Action Plan. So, parang okay na okay kami doon. Nag-umpisa kami sa 16 target pilot hospitals as we were able to finish all the level 3 facilities. Ito yung mga big hospitals with training programs, and then we were also able in 2018 finish level 2. Ito na yung mga medyo malaking ospital. So total mga 400, close to 500 hospitals. Tapos we were really supposed to proceed on to 2019 and try to target a very ambitious number of 788 facilities. Parang very concerned kami over how much we can finish kasi dami-dami pa lang level 1 facility, yung maliliit na mga lying-in clinics, maliliit na ospital, yan, lahat yan level 1. And in 2020, we were supposed to reach all sectors already, including professional societies. Pero we were not able to do that kasi nagkaroon ng stoppage. No? Nagka-problem kami with budget, so we weren't able at all to proceed. So, in 2020, nagkaroon na ng budget. So, noong January 2020, ito na, nagmi-meeting na ulit si DOH and sabi, sige, let's redo our schedules and recalibrate because we could now pursue our previous plans and start to train and continue with the AMS program. Pero before we could launch the program, na dumating na si COVID. So, na-stop kami ulit. So now we're into trying to again recalibrate. No? So in the midst of all the pandemic, we thought we needed to reinvent the wheel, creative retraining. So wala nang face-to-face yung mga training. So we're making new modules na virtual. We're going to realign the antibiotic guidelines and do all of this. No? So strengthen advocacy through virtual networking and make infection control more efficient in the hospitals. Yung surveillance challenge talaga kasi parang ang hirap mag-surveillance by remote pero more and more there's technology that's being set up to make this possible. So, what are some of the AMR solutions? No? So, meron namang sinabi yung group ni Economist O'Neill. No? So, he said, kung merong some warning systems that could help improve AMR. So, kung meron ng nagsasabi, sa region na to, ganito nakataas yung multi-drug resistant Pseudomonas, baka maging mas alert tayo. He also said na baka if we do more of the vaccinations, that will also reduce the need for antibiotics. So please, mga QualiMed clinics and hospitals, continue to try to increase your coverage for the vaccines. No? So yung mga infections that would be prevented by the use of vaccine should be optimized. Tapos maganda rin na you have diagnostics in place. So for example, minsan maganda rin kung may things like a really good laboratory for microbiology and then some other rapid tests like yung mga procalcitonin, yung mga rapid dengue test para alam nyo na kaagad na dengue pala to, hindi pala to UTI. Parang gano'n. So things that will make decision making better and reduce the usage of antimicrobials. So this is parang how it looks like kung makagawa na tayo ng rapid diagnostic test. Kung alam na natin na kunyari strep throat siya because you're able to do an ASO, then baka mas clearly, mas konti na yung gagamitin mong antimicrobial agents. Okay. And then other alternative products to tackle some other infections. So, hindi lahat ng solution ay antimicrobial. Baka there's room for more research and other technologies to come in to also tackle how to manage and prevent infections. Tapos each one of us really has a role dito sa AMR. So yung physicians, tayo yung parang pinakamalaking role talaga. No? So recently, there's already the clinical management of COVID-19 that came up. Di pala to recent, no May pa to, and they're trying to update this. So sinabi dito na appropriate prescription is very, very important. No? So they have very specific recommendation. So, try not to prescribe antibiotics kung ang tingin nyo viral infection. So, mild COVID-19 will not benefit from antibiotics like azithromycin. So, kasi yung azithromycin na prescriptions at saka consumption, sobrang tumaas talaga nito. Parang people are getting azithromycin left and right. So remember, kung hindi niya talaga kailangan ng azithromycin and you think it's really a viral sore throat or it's COVID pero it's mild or moderate, baka hindi kailangan magbigay ng antibiotics. If you're unsure of the diagnosis, then get tests or samples and reassess. The WHO recommendations also said for confirmed moderate, parang sabi rin niya, do not prescribe unless there is a clinical suspicion for bacterial infection. So, try to discern this very carefully. Pwede naman, for me, parang I would not judge a doctor kung tingin niya talaga may bacterial pneumonia then go ahead and treat. Pero kung tingin niya talaga purely COVID-19, so the WBC, for example, is low, mga kunyari WBC of 3. So parang wala siyang signs the procalcitonin is normal, baka wala talagang indication for starting antibiotics. And even if you do start because you think meron bacterial infection, nag-culture ka tapos negative, and then you maybe can stop the antibiotics. Okay. Pero when you are dealing with suspected or confirmed severe COVID-19, ito yung third bullet, yan yung may check. Then the use of empiric antimicrobials to treat likely pathogens is considered recommended. So this is something good to do. Ideally, get your blood cultures and other tests that are important. So meron tinatawag, medyo bago to sa WHO, yung aware, access, watch, and reserve. So dinivide nila yung antibiotics to access. These are your usual empiric therapy. Yung watch, yung medyo nire-reserve mo. At saka yung reserve, yung restricted antibiotics. There's also the phenomenon of telemedicine, which started to increase at the time of coronavirus. No? So nag-shift talaga yung telehealth consultations during the pandemic. So these were found to exacerbate antibiotic overprescribing. So nakita nila na pagka pala telemedicine, pre-COVID pa nga tong mga journals na to, pag telemedicine, they are more likely to receive antibiotics kasi siguro hindi natin talaga fully ma-assess pag telemedicine, di ba? So para you err on the side of being safe and they're likely to receive more antibiotics at saka they're less likely to receive guideline recommended antibiotics. So that's a phenomenon we need to recognize and just be on the alert na pag nagta-telemedicine consults tayo, niisip pa rin natin, kailangan ba ng antibiotic o hindi? Okay. And this is something that's very, very interesting. So may mga groups kasi, baka QualiMed nga does this, no? Yung merong satisfaction scores and maybe some hospitals they give additional bonus to some physicians who really score very high in satisfaction scores given by patients. At ang sure ball daw, 5-star yung doctor or 10-star pagka nag-prescribe siya ng antibiotics. And look at this data, no? So the more you prescribe antibiotics, the higher your score is with patient satisfaction score. So there's that observation or that's phenomenon for the patients. Parang ikaw siguro at some point, meron kang dinadaing sa doktor, tapos hindi ka binigyan ng gamot. Sinabi niya, viral lang po yan, uminom ka lang ng vitamin C or uminom ka lang ng tubig. Di ba parang hindi ka daw satisfied? So parang ganun siguro yung experience ng many patients. And this is already beyond that what the doctors can control. Ako naman ang sagot ko dito, siguro we need to advise, educate our patients a little bit more. Take that extra mile to re-educate our patients na hindi naman po siguro kailangan na antibiotic, ito yung gagawin niya. Parang ganun. But this data is very revealing, no? Na you get high scores kasi you prescribe. So parang positive feedback yun sa'yo. Because you scored high, you'll do that again and again, which is something we need to correct. Okay, so there are guides to better antibiotic use. So may 2017 yung tawag NAG, National Antibiotic Guidelines. I-update na yan very soon. Siguro this 2021. At saka there are other manual of procedures both from the WHO and from the DOH. So it's important that we realize every prescription matters. So when we're in the clinic or when we're in the hospital, try natin mag-pause a few seconds and rethink kailangan ba talaga ng antimicrobial agent nitong pasyente na to. So just to remind us na it's not hard to create drug resistance, no? So for example, here yung picture dito, over 10 years fully resistant na yung microbial that was on this plate. This is an isolate and there are antibiotic discs, no? So dati noong 2009 may area of clearing around the disc. So that means pag nag-diffuse na yung antibiotic, napapatay na niya yung bacteria around the disc. But you would see in 2019, wala nang area of clearing. Ibig sabihin, resistant na yung bacteria to all those antibiotics in the discs. So, merong very interesting, baka nakita nyo na to, but I'd like to show it again to you, that there was this experiment and they try to recreate how E. coli will flourish over an agar plate in the presence of some antibiotics. So yan, kita nyo. So, ang experiment dito, bawat column, pataas ng pataas yung dose ng antibiotic. This is E. coli. So, magta-travel yung bacteria, pero makaka-jump siya sa next concentration. Kasi nag-e-evolve siya at nag-mutate. Nagde-develop na siya ng resistance quite easily until such time na kahit dun sa gitna na highest concentration already of the antibiotic, it was still able to flourish. Na-fill up niya yung agar plate with millions and millions of colonies of E. coli. So how long do you think it took for this E. coli to develop all these mutations? No? So ang sagot dyan ay over 200 mutations in just 12 days. So pag binigyan mo pa lang ng, let's say, nag-prescribe ka ng coamoxiclav, for whatever reason, kunyari for cough, nagbigay ka ng coamoxiclav, very soon magkakaroon na ng changes dun sa mga bacteria, sa ecology within that patient. No? So again, it's not difficult to produce this resistance patterns. So some of you in the audience may be nurses. You still have a role in AMS. Usually, we rely on the nurses to do the long advice and consultations and make sure our patients are compliant. No? Yung according to how we wrote in the prescription, yun yung ipa-follow ng mga patients. Pharmacists also have a large role in AMS, and that's listed here as given by the president of the Western Pacific Pharmaceutical Forum recently in his lecture. And of course, the laboratory also has a role in AMS. For laboratory people, I'd really like you to set up something that is called the diagnostic stewardship in your areas so that you help the clinical teams to make better decisions about antibiotic prescribing. So all in all of us, pati si Boss Edwin na president ng kumpanya, they all have administration and the frontliners and the back end of work all have roles in AMS. So recently we finished the the World Antimicrobial Awareness Week. So nagkaroon ng big role yung DOH, tapos nagkaroon din ng malaking role ang Philippine College of Physicians. Doon kami nagkita ni Monica the last time. And in that forum, we actually asked, and which you can do later on, if you plug into the Pledge Antibiotic Awareness Week.org. It's still present in the website. If you press into that, you can look at, kasi hindi pa natin reach yung 1 million pledges na target nitong website na to. This is a WHO initiated advocacy. And we'd like to see more and more stewards who will commit to making sure that our future will be okay. So, i-click nyo yung Take the Pledge, Tapos it will put you in this page, and then you can make the pledge to use antibiotics responsibly and create awareness about AMR. Yeah. So in time, each one of us, all of us, need to really be engaged in the fight against AMR through some form of stewardship. So AMS or diagnostic stewardship, any kind of stewardship will be okay. Basta we are all together in the fight. So these are the messages to take home. So number one, that AMR is really urgent and it's a serious global problem. And there are many solutions. And one of the very good, clear-cut, effective solution is be a good prescriber. And despite major obstacles like COVID-19, we really need to continue to combat AMR. And all sectors, all hands on deck have to have a role in the fight against AMR. And surely, yung apocalyptic 2050, baka sana it will not happen. Because together we have to and we will succeed. So yan, thank you for your attention. Fight COVID at sa PGH, ika nga ay tuloy na tuloy pa rin ang tunay na diwa ng Pasko. So this is to acknowledge the teams that I've been working with in PGH, in COVID, and in AMS and AMR. And in behalf of all of them and for all of you, maligayang Pasko po. Thank you very much.
Thank you so much, Dr. Nina. And yes, Merry Christmas. So just to give an answer to some of your queries earlier, yes, we have an AMS program in PolyMed. It's in place and it's still continued even during this pandemic. So as you mentioned earlier, we have been having this weekly webinars and we had many topics actually on infectious diseases. So hopefully that could help our physicians in improving their antimicrobial prescribing. So we also have procalcitonin and other point of care tests like the dengue NS1, IgM, IgG. We also have the rapid antigen for SARS-CoV-2. And we also have our own molecular lab. So the turnaround time for our COVID patient, the swab results of our patients is fairly quick. So it decreases antimicrobial use. So I think we have one question from Dr. Mercado. So his question is there coordination by DOH with other agencies like Department of Agriculture to implement One Health policies as a lot of participants are becoming cross-species?
Oo, so ang sagot ay yes. Initially, nung nag-start off yung AMR ng country natin, parang hindi masyado nag-take on yung DA, Department of Health. But since around 2018, they've really been going around. Nagkakaroon na sila ng surveillance. They're part of the One Health approach already. At saka they have more and more, may surveillance na sila. Tapos meron na rin sila yung equivalent ng AMS in animal health. So yes.
So yeah, that's good to know because from one of my lectures, there was a veterinarian and I was surprised because parang she said that they have been using colistin frequently among animals. Pag sa ating mga patients na humans, parang sobrang for multi-drug resistant organism na tapos sa mga animals pala medyo left and right siya. So I think there are no other questions. For those who want to ask more questions from Dr. Nina, you may just type them on our chat box.
Comment lang, Nina, doon sa pinakita mong patient feedback. Medyo disputed na nga yun eh. Dati, di ba, may mga press Gini scores pa.
Ayan, narinig ko na. Yes, pwede na.
Hello. Di ba, yun nga, it's like giving the candy store to the kids eh. And that affects the given pa na may bonuses. So lalo na yung mga opioid use, tumataas din kasi yung mga pasyente gustong-gusto mabigyan sila and it actually led to an opioid crisis in the States right now. So medyo I think a lot of the new hospital systems are rethinking the patient feedback form na hindi masyadong reliant on those but more on outcome.
Oo. Kasi talagang nakakalito 'di ba? Kung ikaw yung physician tapos parang may second gain ka by giving antibiotics. Mag-antibiotics ka talaga,
Yes.
magpe-prescribe. So, it's not a good, hindi siya magandang system to use.
Okay, I have a question, Dr. Regina. So, because we know that when we talk about antimicrobial, it's all encompassing. So, it includes antibiotics, antivirals, antifungals, and all that. So, now with the COVID-19 pandemic, are you considering, or in your other hospitals, aside from PGH, are you regulating the use of the antivirals? Should they have prior approval from the AMS team prior to giving those antivirals?
So, you're maybe talking about mga remdesivir, tsaka maybe favipiravir.
Yes, no.
Oo. So, yung favipiravir talaga, wala pang clear data on it. Pero because there's a lot of compassionate use type of stocks that were given. Tapos there are some patients who really ask for it. So, ang stand ngayon ng DOH is to let the compassionate usage allow them to use them in that way until more data becomes available. So yung study kasi namin, I was telling Edwin kanina, dahil ang konti na ng cases, wala na kaming ma-recruit into the trial. So yan. So I don't know. Hindi pa enough yung aming na-recruit na sample to give any clear-cut trends about the usage of favipiravir. Yung remdesivir naman, as WHO was saying, di ba, parang individualized decision making at this point, hindi pa siya mabigay talaga in general especially for program on a program level. So, wait and see for more data also.
Okay, are there any other questions from the floor?
Pero Monica, hindi namin kino-consider i-restrict yung mga antiviral agents at this time. I think the science is not very clear yet on that.
Okay, Doc. So another question from our medical director, Dr. Maravilla. How can private hospitals like QualiMed be directly engaged as part of the DOH programs on antibiotic stewardship or antimicrobial stewardship?
Actually, yung naka-attend na ba kayo, Monica, ng any of the AMS trainings as QualiMed? Kasi we could include you as QualiMed.
Sorry, Doc, I cannot answer for QualiMed because I only started during this pandemic. So I will ask Dr. Pasayan. But yes, if we're very much willing to attend and we want to attend, hopefully by next year, resume na po ulit yung mga AMS training for the hospitals because medyo na-stop or nabawasan this year. So yes.
Oo. So Dr. Maravilla, bali yung mga, lahat po pati ng private hospitals. So dyan sa Santa Rosa, like yung TMC Santa Rosa was part of the AMS training. So the DOH, when it committed to starting off the AMS program, it included all government and all private hospitals. So baka di pa namin kayo kaagad nakita at that time, but we could take note of your different QualiMed hospitals across the Philippines yan, di ba, Edwin? And we will include you in the training. Kasi in time, magiging part ng requirements ng licensure. Or renewal of licenses ng hospital. Yung the presence of an antimicrobial stewardship program and a present in person, yung AMS team. Magiging part po siya ng requirements for renewal of license in the future. Kaya pine-prepare na po namin lahat ng ospital.
So Dr. Maravilla said that our AMS program were previously affiliated with Asian until the Daniel Mercado Medical Center was approved. So actually, just before the World Antimicrobial Awareness Week, the hospitals that were trained previously were already requested parang audit. We were requested by DOH AMS team to submit our files. So they were collating it already, no, to check how our AMS programs in different hospitals are going on. Okay. No more questions. So yeah,
I have a question. Monica. When is the start, Nina, when is the start of the online training for AMS?
Wala pang schedule. Sabi ni, siguro daw first quarter.
First quarter
of 2021. Kasi finalize pa namin yung modules.
Thank you.
So we can keep in touch, Dr. Regina and Dr. Edwin, for inclusion into the virtual trainings.
Thank you.
And Gina, yung mga protocols nga to align with the EMS. Kasi meron kaming surgical site infection lecture din, Nina eh. And marami talagang yung concept ba na dahil ang sitwasyon sa Pilipinas medyo mas madumi daw, nagbibigay talaga ng buong duration ng antibiotics post-op. Lalo na ortho. Kaya siguro i-align na natin, Gina.
Sabi nila low-hanging fruit daw yun. Madali lang. Mabilis naman daw makausap yung mga surgeons and orthopedic people. Tama ba yun, Monica? Madali sila kausapin.
Depende po.
Sabay lunok no? Actually, yun ang reason, Nina, kung bakit kami lecture series. Kasi para nga ma-update yung mga doctors regarding healthcare-associated infections at saka yung rational use of antibiotics. Yan.
Okay. So, I'll keep in touch with all of you. Tapos, tingnan natin. Kasi wala pang definite schedules next year.
Okay.
But surely next year yun.
Okay, I guess there are no more questions. So Dr. Nina, on behalf of Polymed's Patient Safety and Quality Management and of Dr. Regina Nazareth and the rest of the management, we extend our sincerest gratitude to you for devoting time to enlighten us on AMS. And we're all looking forward to everyone joining us and becoming guardians of antimicrobials and stewards to fight against microbial resistance by also promoting the use of vaccines. So with that, I'd like to end today's scientific web forum. If there are no more questions, we'll end this here. Thank you very much and happy holidays.
Thank you very much.
Thank you, Nina.
Bye.
Thank you, Nina.
Bye, Edwin. Bye, Gina. Bye, Monica.
Bye. Thank you.
Bye po.